Good morning, my name is Garcia, and today we're talking about diabetes mellitus. Diabetes is a disease that consists of alteration of carbohydrate metabolism that occurs due to insufficient insulin secretion or a lack of insulin activity. The two most common of diabetes are diabetes type 1, known as insulin dependent, and diabetes type 2, known as non-insulin dependent. Okay, diabetes type 1. It is caused by the autoimmune destruction of the beta cell of the pancreas. Insulin therapy for life is currently the only treatment for that disease. Diabetes type 2. It is the most common form of the disease. Type 2 diabetes is usually managed with exercise, oral hypoglycemic drugs, and sometimes insulin. Gestational diabetes. It is a type of diabetes that is first seen in a pregnant woman who did not have diabetes before she was pregnant. It usually appears in the middle of the pregnancy. This type of diabetes goes away after the baby is born, but if it doesn't go away, then it's turning into type 2 diabetes. Symptoms: hypoglycemia. We have hungry, headache, pallor, excessive cold sweating, dizziness, palpitation, trembling hands, blurry visions, drowsiness, difficult waking up, confusion, lack of concentration, abnormal behavior. Hyperglycemia, increased thirst, dry mouth feeling, urinate more frequently, abundant urination, high sugar and acetone in the urine, tiredness, weakness, and general discomfort, loss of appetite, abdominal pain, nausea and vomiting, fast labor breathing, apoplectic rate, acetone. Can diabetes be cured? Both type 1 and type 2 diabetes are chronic lifelong conditions. Currently, there is no permanent cure for either type. Gestational diabetes can be cured with exercise and good diet to avoid developing diabetes type 2. Treatments: diabetes education for the patient and family, diet, physical exercise and healthy habits, no smoking to avoid heart disease, weight reduction. Medication for type 1 diabetes are insulin, while the medication for controlling type 2 diabetes are metformin, glucophage, pills that release insulin, etc. Is diabetes hereditary? People with type 1 diabetes need to inherit risk factors from both parents. Type 2 diabetes has a stronger link to family history and lineage than type 1. However, lifestyle also plays a role. How long is the average lifespan with this disorder affected? According to the study in 2010, diabetes could have an average of 8.5 years from the lifespan of a 50-year-old man with diabetes as compared to the one without diabetes. How is the family of the person with this disorder affected? Diabetes doesn't affect just the person who is diagnosed with this condition. Families are involved with this patient's ongoing medical care. They help with paying doctor visits, blood testing supplies, healthy foods, etc. The family support system is crucial for diabetics. Is diabetes dominant or recessive trait? Diabetes type 1, the tendency toward this disorder is influenced by heredity by not transmitting as a dominant or recessive. It falls into a category called multifactorial, in which the gene is several different locations and possibly several chromosomes may come into play. Gestational diabetes and type 2 diabetes are related metabolic conditions with strong inherited genetic tendencies. So, GDM and type 2 diabetes is neither a dominant nor recessive trait. Whether a person gets GDM and type 2 diabetes is also strongly impacted by age, weight, exercise levels, dietary factors, which are not genetically determined. How common is diabetes? Approximately 30.3 million people in the United States, or 9.4% of the population, has this health condition according to the CDC. Diabetes affects 1 in 4 people over the age of 65. About 90 to 95% of cases in adults are type 2 diabetes. How many get diabetes each year? In 2018, an estimate of 1.5 million new cases of diabetes were diagnosed among U.S. adults aged 18 years or older. This includes approximately 210,000 children, adolescents younger than age 20 years. Is there a certain race it is most common in diabetes? African Americans, Hispanic, American Indians, some Pacific Islander, and Asian Americans are at a higher risk for type 2 diabetes than Caucasians, according to the American Diabetes Association. Is more common in men or women? Diabetes, especially type 2, is more common in males rather than females. However, females often have more serious complications and a greater risk of death. What I learned about diabetes? I learned that diabetes is a disease that one can easily control by following a good diet and exercise. I also investigate diabetes can develop through a mild and chronic elevation of TSH, thyroid cancer, and thus discovered the cause of my thyroid cancer 11 years ago. If I had followed a good diet and exercise, I would not have had any chance of having thyroid cancer at that time. Conclusion: diabetes is a disease that has multiple causes, such as a poor diet and the genetic predisposition to said disease. It is also have several consequences such as diabetic coma, cardiovascular kidney complications, etc. It is important to prevent it with an adequate diet, physical activity, and take your medication if it's necessary. The website that I use is on the page. Thank you very much and have a nice day.